Sir is a wonderful writer, apart being from a doctor. In this magazine of games, Sir wrote a wonderful poem on COVID. His experience is extremely profound. He's a diplomat of the American Board of Psychiatrists and Neurologists and an executive board member of the APA Art Council. Dr. Mukesh Latia writes from 10,000 miles away, literally and emotionally. His piece on India's second COVID wave reminds us that medicine is not just science, it is also grief, memory, and resilience. So the stage is all yours.
Thank you so much. It is wonderful to be a part of this group. Great to see that Games is Games is doing so well. I see Dr. Lokesh Sadara here, and when we were young, we could not imagine the organization coming along so well. You all are doing such a good job. I had a chance to take a little bit of a glimpse of the magazine, and it is so wonderfully done. It's greatly done. So it's good to see that that the young doctors are coming along so well, and we would love to be a part of the games and help. Sitting here right from US anytime. Um, the poem that I wrote was after the second COVID wave, and frankly, it was written after my best friend from medical school passed away in Gujarat, and so many of my relatives, just like many of your relatives, must have been affected by that. And then I wrote the poem. But of course, like there is some grief, but a lot of resilience because ultimately, we could deal with COVID just like we could deal with other pandemics in the past. So the the poem, although may appear a little pessimistic, it does show that there is that resilience, and sometimes, of course, there is this dichotomy we face um, as we have settled in US, and then we look at the realities in India. Uh, but we are there, and we will help. The Indian medical fraternity. Dr. Adara has been doing that for many many years, and please let us be a part of that. So one of the most important thing that was mentioned here is not just the number of medical graduates, but also the people who stay there. So anything that we can do, please reach out to any one of us. Um, People from RP, which is American Association of Physicians of Indian Origin, and we would really love to be a part of that. Now with all the technology and everything, we are not we are not far, and we can do anything from here to help you. So, I would like to thank Dr. Abhishek Kashyap to give me this opportunity, and a lot of exchanges need to be done. I like to get involved very much because I'm a psychiatrist in the mental health over there. I had treated some patients in India, particularly in Calcutta, and that would be something that if Games takes over or the next president also takes over, Dr. Kashyap has done an amazing job. That is something I would like to get involved. Thank you very much. This is great. It's great to see young faces here, really. And I wish we had such an organization when we were young. But you guys have done an amazing job. The magazine looks great. Thank you so much.
Thank you, sir. Thank you for your wonderful insight, sir. It was really insightful, both literally and emotionally. Thank you. So, Dr. Bhatia is here, so I'll have the pleasure to introduce him again. Please allow me to do so. So, our next speaker is Dr. Mukesh Bhatia. He is a senior medical educator and general medicine faculty for NEET PG with over 3 decades of teaching experience. His piece in this edition makes a powerful case for integrated interdisciplinary learning, arguing that academic success in medicine is not about studying harder but studying smarter. Please welcome Dr. Mukesh Bhatia. Sir, the stage is all yours.
Thank you very much for giving a chance to speak to the illustrious gathering. As NEET exam is just on the door, I'm going to tell you something which 99% students do not know. But I'm going to tell you how paper is set. Okay, well, before that, I just want to tell you one thing, which everybody knows. Around 2.5 lakh students, they write PG entrance exam, and the interview call comes only to 70,000. That means out of 2.5 lakhs, 1.80 lakhs people are rejected. So PG entrance is more of a rejecting exam. Out of 70,000, if I asked you which branch you want, okay, everybody says I want medicine, surgery, ped, gynae. Nobody want anatomy, physiology, biochemistry. Moreover, nobody want to go to private colleges. So what I say, creamy layer. For the to get a seat in creamy layer, you have to be among the top position. That means you have to be among the
You're muted, Dr. Bhatia.
Is it okay now?
Yeah, you're back. You're back. Yeah.
So now I tell you how paper is set. If you are, all are having a paper pen, you write it down. If in the paper setting of NEET PG, they use two criteria: difficulty index and differentiation index. What are these? 20% question are those which can be answered by 80 to 100% student.
I think we lost Dr. Bhatia. Is it?
Yeah, I think he's joining again, maybe.
So,
Or we'll
yeah,
go to.
I think he's joining back.
I think for the timing, we'll move to the next speaker because I think Dr. Mukesh sir is facing some network issues at his end.
What we can do is, by the time he's back, we have a launch video prepared. So I think Sushmit can do the play the video at this point, and then we'll have Dr. Bhatia as well.
Yeah, that's a wonderful idea. I think we should go ahead with the video presentation.
Finally, they are
Sushmit,
able to.
Sushmit, the
Finally,
audio
they are.
is
Finally, they are able to make a rank 1, 2, 3, 4. This is difficulty index. Now I give you one example. If a question is asked on spironolactone, examiner notes that this can be answered by 80 to 100%. But if I ask you one question on eplerenone, okay, that can be answered by 60 to 80%. But if I ask you question on finrenone, can it be answered by 20 to 40%? But if I ask baxdrostat, that can be answered by less than 5%. All are potassium sparing diuretics. But as I told you, if you want to get a come to creamy layer, that means a good branch in a good college, you have to be among the top position. That means you should know those answers which can be answered by only 10 to 20% people. Rest all they will not be able to answer it. Now what you do? Now one more. Today examiner want your basic concept should be very clear. Forget the old days where you can ratify, ratalo or boldo. No, they are not going to ask you. Remember, previously, 300 questions to be done in 3 hours. Now, 200 questions to be done in 3 hours. They have increased the length of question. Now they are made just like USMLE type of question. In USMLE, they don't ask a question, a subject, they ask a topic. You can now, for example, a patient come to you with pain chest. Okay. And in the ECG, there is ST segment elevation in V1, V2, V3. Which artery involved? Now, this anatomy question, they correlate with the ECG and clinical side also. Of course, the answer is LAD. Now, they are not going to ask LAD supplying the enteroseptum. So, friends, if you really want to take a top rank, then you should know the basic concept. Do not rely on simple mug up. Mug up has no value. With mug up, you will not come to Unica creamy layer for which you have been struggling. Okay, I have a 1 full hour lecture where I can mentor you, guide you how to study only 1 hour per day to top in any exam. Of course, the time is very limited, so I will not cross my time limit. I am a disciplined speaker. At times, speaker keep on speaking for hours together. No, I have been allotted 10 minutes. Already 7, 8 minutes have crossed. So I'll just take 1 or 2 minutes. So what you learn in summary, let me summarize what I told you. Nowadays, because remember, PG entrance is a more of a rejecting exam. There are two criteria they use, that is difficulty index and differentiation index. If you really want to come to the creamy layer, your basic concept should be very, very clear. Next, last but not least, you should know the latest concept and latest drug. If you want, I can help you about this, about latest drug. Those drugs which have been launched in recent months, which are not there in latest Henson also, latest pharma books also, I can give you that also. And if even 10 questions you can do, which you will do, others will not do, 40, 50 questions will make the entire difference. I am there to help you out in every possible way. Anybody can contact me. I'll be very happy to help you out. And finally, all the audience must thank the team of GIMS who have really, really worked hard to create this session. Thank you very much. And like a disciplined soldier, I finished my talk within well in time. Anything I can do for you, always welcome. Feel free to talk to me. Thank you very much. Thank you very much.
Thank you so much, Dr. Bhatia. That was an incredibly grounding perspective on how we learn and how I think every student in this room has something to take away from that. It was really interesting and very insightful. Thank you so much, sir.
Thank you. Thank you. Thank you very much. Thank you very much.
Now we
All the
move.
best.
Thank you, sir. Thank you so much. Now we move to our next contributor for this edition, Dr. Lokesh Adara. He is a former chair of the board of trustees at AAPI USA, and his article in this edition tackles one of the most structural challenges facing Indian medical education today, the PG seat deficit. He presents a practical, scalable, and very productive pathway through family medicine that deserves serious attention from the policymakers and the students alike. Sir, the stage is all yours. Please welcome Dr. Lokesh Udara.
Can you hear me?
Yes, sir, you're audible and visible.
Oh, thank you so much I hearty congratulations for James doing this project. I think 6, 7 years ago I co-founded with Subham. James, I think, is coming a long way. And I thank Dr. Latia sir and Dr. Bhatia sir. I heard about you and your great guidance to all the students in India. I'm glad to see you, sir, here. So two things we're talking about. One is PG seats, because everybody's dream is PG seat. And then globally, 30% are family medicine in the UK, 40% PGCU in family medicine in Canada, 13% America. India is 1%. And both the ministry and the NMC chair said we want to give one PG seats, one MBBS. We totally, that's what we need. Developed countries, like Modi ji said, Viksit Bharat. Developed countries not giving license to MBBS anymore, 2 years PG minimum. We're 40 years behind. So for that reason, we're requesting the family medicine Um, look into that. I am already have an opportunity to bring NMC leadership to NBME. NBME is the 100 years old association in America. They are the owners of USMLE. 1956, they went on MCQs, 100%. They never looked back. NBME is the only research institute in the world to do the research and assessment. India did the CBME syllabus, but not adopted assessment. I have lined up, I think NMC I can show in the screen. They said 20% limit in MCQ. That is cutting off your legs, students' legs cutting off at the age of first year. You have to have 100% MCQ. That's so insane to have a essay short questions, does not give the Bloom's level taxonomy 5 and does not give in the implement the concept ownership. Nobody in America going to classroom, even Harvard. You are self-learners. You are the greatest tool. I'm learning from you every day. I'm talking about you, the students. So there are two things I want you to do, James do. They did do a book. James doing the study book for every student. That will help how to prepare day. 1 minute. Fine. Prepare for I'm sorry, I have a patient in the room. How to prepare day one for long time. See, our students are brilliant. How come in America, 24 months, every student pass USMLE step one, 96%. For first for 24 months, we're you smart people. You got the PG seat, MBB, UG seats. You're the smartest. You read 20,000 questions. You have MBBS. What are they doing in 4 years medical school with this nonsense essay short assessment? Stupidity. They have to implement the day one. You agree on it, student, but I'm for last 7 years. I'm begging them to change it. There, I don't know how do they can reach the next exam. But anyhow, we like the James to study a book, which the protocol and Sir Bhatia sir is there. I'm sure he can give us guidance how to prepare, self prepare, and all the things. Maybe they have their tools like Bhatia sir. Other people can provide the tools to learn. Or people can subscribe. And number two, family medicine. We wanted to do every family medicine. There's 7 or 8 advantages. One is it will treat the rural patients. We all agree without PGCs, no medical college will run. So how come 6,000 community health centers in India can run without PG? How come a subdivision hospital 1,000 can run? You need you. There is the other question is they have unnecessarily bond. They can use that money to give the PG seats. So we need your not only advocacy, you need to put your pressure, take all your resources. We took the games as part of the API India Foundation. We're trying to push it, but we have a limited role as an outsider. We can give advice, we can do the research, we can publish, we have goals. So I'm sorry I went off the topic. I'm going to stop here because I have access to all of you guys, and I will stop here. Thank you so much.
Thank you so much, sir. Your address was really thoughtful and actually very thought provoking, rather. It gives us an insight at how Indian medical education should change their assessment criteria, especially when the CBME is implemented.
Yeah, 1 minute. I think the political they're scared. Politicians are scared of now cockroach. So you need to have approach of the young gen. They're worried about you, but they're once concerned about it, and you have to take role of it. You have to be active and advocacy with evidence-based information. We're not talking about the talk. We're talking about the higher order. I'm attending one of the medical education meeting in Vienna, and they're one of the best medical education association called AMEE. And the main is not just attending. I want India to develop our own AME strongest association. So you are the ones they will listen to you. You may have to put the cockroach thing, whatever it is, but yours is evidence based. I can provide all the data. Thank you. Sorry, I had to intervene in that word. Thank you.
No, no, thank you so much, sir. We have about as a European association, as far as I know. So thank you so much, Dr. Adara. It was really a system level view that puts the policy conversations exactly where it belongs. And I think people in this meeting and also outside this meeting should take points from your address. Thank you so much, sir.
Okay, thank you. I had to see the patient. I'll come back.
Yeah. So our next contributor represents exactly the spirit this magazine champions. Currently pursuing his MD in community medicine and already an active medical health activist, Dr. Dhruv Chauhan. He challenges us to reimagine the doctor's role beyond the clinic into policy, advocacy, and public health. His piece on expanding the role of young doctors in modern healthcare is a call to action for every medical student in this room. Sir, the floor is all yours.
Hello, am I audible?
Yes, sir, you're audible.
Yeah, yeah. Okay. Actually, I'm outside and traveling at some place, so that's why you know there's there might be some issue with the network, and also please forgive me before that. Firstly, good evening, everyone, all the respected dignitaries and everyone here, especially my friend Dr. Shubham Anand, and who is the main person behind this Global Association of Indian Medical Students, Dr. Abhishek, who is leading it right now, Dr. Lokesh Dar, sir, Dr. Mukesh, sir, and all the dignitaries who are here. So it is an honor for me and a privilege to be a part of the Games Access launch. And thank you so much. And today, as we are discussing, as I have written an article and I have shared the article regarding the role of doctors beyond the hospital walls. And today, I was just going through the news and I found that the government has changed the diploma system, where the degrees of diploma are now converted to MDMS. And now a lot of people were very surprised with this action, that how this has happened, well, how actually this happened. And many people don't know, but this issue was being raised to the government by various medical organizations as well as medical students and doctors for a long period of time. And they were all raising the issue, okay, why there is a discrimination based upon the degree, why someone with diploma is not able to work and get salary equivalent to an MD MS and other issues. And today, with all these efforts by the medical student, by the doctors, the reform has come, and now the MD MS, this diploma courses are equivalent to the MD MS courses. So, what I mean to say with this, because this is a recent update and recent news that we are going through, that we have the power to bring changes, to bring reforms, and we are doing it almost every day. And so is the thing. And I have recently joined this MD community medicine, and since it's a place for the research, an article place, so I would like to share the knowledge that I have gained through during this time. So my guide taught me that there are 5 pillars when we talk about research. There are 5 pillars. Why should do some research? Why you should publish magazines, or why you should publish articles, researches, and all. The first thing is the novelty. I would like to mention the 5 points. The first is the novelty. Like, why should anyone care about the research that you are doing, about the article that you are publishing? So this is one of the most important. What new knowledge you are going to give to the world? This is what my guide has taught me. The second thing he taught me was the methodological rigor, where whatever you are publishing, can those findings be trusted? That is he explained me in a brilliant way that appropriate study design and adequate sample size, whatever you are studying about, can this be done like that? The third thing was the ethical integrity, means whatever you are doing, whatever research you are doing, whatever article you're publishing, can it be conducted responsibly, right? So without ethics, no research is worth it, right? There has to be ethics committee approval, there has to be informed consents about your researches, and etc. Now, coming to the fourth part is the scientific communication. Whatever you are publishing in the article, will the others be able to understand it? That is very important. And the last thing that I would like to mention is the impact and the relevance of the study. Like, whatever you are putting on, will it make any difference? So these are the 5 pillars that I wanted to share, because I'm on a launch of a magazine which deals with the research part. So I just wanted to share my part that I have learned, and I wanted to share that this is how you can use the 5 pillars and actually go and give yourself the contribution. I mean, like, contribute yourself to the research world. So thank you so much. I'm outside, so that's why I have not turned on my camera. And thank you so much for inviting me to speak on this platform.
Thank you, sir. Thank you so much for joining us despite your busy schedule. All of us at the Games family really, really appreciate it.
Thank you so much.
Thank you, sir. So now may I have the privilege and honor to again invite our national president, Dr. Abhishek Kashyap sir, to take the stage and launch the video of the magazine. Abhishek sir, are you here with us? Dr. Prakhar, I'll request you to take forward the video presentation for all our audience to see.
Yeah. Sushmit, can we have the video playing on screen share, please?
Here, today. Every edition begins with a question about healthcare, a question about education, a question about the future. Over the years, Games Access has become more than a magazine. It has become a platform for ideas, a space for conversations, a home for voices that seek to inspire, challenge, and create change. Through every edition, we have explored new perspectives, new challenges, and new possibilities. But the story does not end here. Today, medicine stands at another crossroads, breaking silos in education, the rise of integrated learning. Beyond medicine, the skills that shape a doctor's career, toward one PG seat for every MBBS graduate, a practical, scalable pathway through family medicine. Competence speaks louder than assumptions, a journey to neurosurgery, and stories of leadership, service, innovation, and impact beyond borders. These are not just articles, they are conversations. Conversations that challenge convention, conversations that inspire action, conversations that shape the future of medicine. And as these conversations evolve, so must we. Presenting the June 2026 edition of GAIMS Access, Medical Education and Beyond Medicine, Merit and Modern Realities. GAIMS Access, the conversation continues.
That was really a wonderful presentation, to be honest. It was really, really good. I personally enjoyed it. I hope all the audience did too. I can see Dr. Dara saying very good. I'm very thankful to you, sir. Thank you.
Who made it?
Dr. Bajpayee is a better person to answer that.
Dr. Idara, this is the creation of our IT team at Games. So
Who is that?
I think so. The credit goes mostly to IT team and Sushmit, who is the national director for IT team.
Okay, share this number to me because I need something.
Right. Sushmit, contact Dr. Idara after the meeting, please.
Yeah, so I'll take it forward from here. So I want to introduce Dr. Nachiket Bhatia as well. He's not here with us, but I'll just introduce him. He's an Indian medical educator and entrepreneur who has worked extensively across medicine, management training, and healthcare entrepreneurship. He has a great contribution in Games with us. His article in this edition carries a message that resonates deeply that medicine opens the door, but skills build the path. He might join us later to speak about the non clinical competencies that truly shape a doctor's career. For now, let me go to the questions and reflections from the chat. Nia, it's over to you. Pull out some of those responses and we'll bring our speakers back in for a few minutes of interaction. Nia, over to you.
Okay, so these are the following responses from the chat. Basically, Dr. Idara sir has requested content for the next magazine on how to prepare NEET PG or USMLE. So we should, they want us to make a book on how to prepare for USMLE and how to remove the concept of rote memorization and to improve concept learning. So we aim to get a medical index journal which is to there are no questions.
Do you understand about the next book I'm talking about? It is about, you can make a book, even put on Amazon, so every student can read how to prepare. And contributors should be the ones who or just took in the USMLE or PG NEET, your seniors, and how to, because nobody is guiding, no matter whether you go on AIMS, any 836 colleges, nobody will guide you. This book could give something they can self-read. Even at Harvard, they don't guide, they read themselves. So that's what this guide, that's what my vision, but up to you guys to take care of it.
Sure, sir. So I'm very happy to again introduce Dr. Nachiket Bhatia, sir. He's here finally to join us. So Dr. Nachiket Bhatia is an Indian medical educator and an entrepreneur who has worked extensively across medicine, management training, and healthcare entrepreneurship. His article in this edition carries a message that resonates deeply, that medicine opens the door, but skills build the path. He joined us to speak about the non clinical competencies that truly shape a doctor's career. Please welcome Dr. Nachiket Bhatia. Sir, the floor is all yours. We are eager to hear you.
Yes, hi everyone. How are things? First of all, congratulations to, how do you pronounce this? GIMS or Games?
GAIMS.
Games, yes. So Shubham is a very dear friend, and I think I owe a lot to him also, because he's a kind of person I've always seen as even my own inspiration कि भाई third year में लड़का हमारा क्या क्या करता है. So always a fan of Shubham and what he has created and what his thought process is. And I really wish that Games is going to be something really great in the future. And this edition, I am honored to be a part of it. Thank you so much, Games, and the complete team, association, organization for making me a part of this event, part of this edition. Trust me, I found it very difficult to write that. So it was a new experience for me. So really liked it, and I really wish the edition can help young medicos. And for being the non-medical side, I really do believe that medicos should be taught skills, because I'm a staunch believer that we are taught the clinical side of the life, but we are not taught non-clinical side of life, where we lack extensively. It can be finance, it can be marketing, it can be leadership. I really believe Shubham is a perfect example of being a leader at a young age. I still remember that I think Games was launched, and I think the whole Games team went to the Vice President of India. Now, I could not imagine doing that while I was in my own college. It was completely mind blowing for me that somebody at this young age could do that. So again, I think these are the kind of skill set that makes you ready for life. So congratulations to the whole team. You are doing great. Your work is amazing. And I'm really glad that somebody is making a change in our industry. Thank you so much. And again, all the best.
Thank you, sir. Thank you so much. That truly and timely reminds us that growth as doctors extends well beyond the wards.
ठीक है जी, thank you.
Thank you, sir. And with that, we bring the game's Access June 26 edition launch to a close. What an evening it has been, truly. I sincerely thank everyone who has joined us today in the game's Access Launch magazine. And I truly appreciate your time despite all your busy schedule. It has been an evening which was filled with incredible insights, thoughtful perspectives, and the kind of energy that reminds all of us why we chose medicine in the first place. Tonight was a celebration not just of a magazine, but of the community of curious, driven, and compassionate medical minds that Games continues to bring together. We hope you leave this event with something that stays with you, whether there's a new way of thinking about your studies, a broader vision of what your career could look like, or simply remind that you're not alone on this journey. I would like to extend my gratitude, heartfelt gratitude, to everyone who has made this edition and this evening possible today. First and foremost, a sincere thank you to our Games leadership and the Presidential Office for your vision, your continued support of student led academic publishing, and for providing the platform that makes initiatives like Games Access possible. To our editorial board and design team, the unsung architects of this edition, thank you for your tireless effort, your attention to detail, and your commitment to quality. Every page of this magazine reflects your dedication. And a very special note of gratitude to all our eminent authors and contributors who so graciously shared their expertise, their stories, and their time with us through their articles in this edition. We deeply appreciate that you took time out of your incredibly busy schedules to not only contribute your writing, but to also join us here in this evening and speak to our audience directly. Your presence tonight made this launch truly memorable and special. To our audience, thank you for being here, for your questions, your enthusiasm, and your engagement. You are the reason we do this. Before we officially leave, I would request everyone once again to turn on your cameras so that we can have a picture. Everyone, can you please switch on your cameras so that we can take a picture? Yeah, thank you so much, everyone. Thank you, Dr. Prakar, for the picture. Thank you. The magazine and the recording of this event will be shared with you shortly. Do give it a read, share it with your peers, and tag GAIMS on your social media. We would love to see this edition reach as many hands as possible. On behalf of the entire GAIMS team, good night and thank you for being a part of this. Thank you, everyone.
Thank you, everyone.